Starting tonight, New York will be put on pause as a city that never sleeps and the entire state shut down all non-essential businesses. Statewide, people ordered to stay home. Across the country, more than 80 million are now under a virtual lockdown. Connecticut, Illinois, New Jersey, and California also under a stay-at-home order, but some young Californians aren't following the rules.
To the extent we feel people remain stubborn over the next few days, we will increase our efforts not only in outreach, encouragement, and to the extent we must on appropriate enforcement.
Overseas, Saturday marked the deadliest day in Italy, 793 dead in just one day. Sobering news as doctors and nurses fear the same fate among Americans as critical medical supplies run dangerously low.
It does keep me up at night. We are running low, very low. We haven't had a delivery in 4 days or 5 days.
With health officials projecting the number of cases to spike even higher, a warning from the country's leading infectious disease expert.
Not every single person in the United States needs to get tested. When you go in and get tested, you are consuming personal protective equipment.
But help is on the way. Apple CEO Tim Cook tweeting, "We're donating millions of masks for health professionals in the U.S. and Europe." Commercial testing is ramping up too, including a new FDA-approved version that could detect the virus in 45 minutes. And while it's a race among researchers to find a treatment for COVID-19, a vaccine likely won't be ready for at least a year. And late Saturday, the governor of Hawaii also announced sweeping new measures for the state, calling it extreme action to stop the spread of the virus while keeping people safe. Starting Thursday, a 14-day mandatory quarantine applies to all visitors and returning residents. Willie?
All right, Kathy, thank you very much. President Trump says he is not yet ready to invoke the Defense Production Act, which would allow the federal government to direct companies to manufacture goods and supplies for the effort to fight the spread of coronavirus. NBC's Kelly O'Donnell is at the White House with more on that angle. Kelly, good morning.
Good morning, Willie. First, an update on the vice president. Test results came back for Mr. Pence and his wife, Karen. They were tested Saturday after a staffer in the VP's office was confirmed to have coronavirus. The Pences do not. Today, the task force Pence leads will brief the public again. Saturday, officials here said the national availability of tests has increased, but they urge that tests be prioritized for hospitalized patients and healthcare workers to conserve those medical supplies like masks and gowns. Now, the president has resisted calls to use a specific presidential power to compel American businesses to make these needed medical supplies. I pressed the president Saturday on why he has not used the Defense Production Act. He said forcing businesses is not yet needed, and instead he praised American businesses that are voluntarily manufacturing these masks and other supplies. Officials have been unable to say when shortages would be eased, but they acknowledged it may take weeks. President Trump is also using his influence to launch a clinical trial in New York for patients already sick with the virus. Now, although there's no scientific evidence yet, the president says he believes specific medications approved for other illnesses should be given to very ill coronavirus patients. This has been tried in other countries with some anecdotal success. Dr. Fauci said more evidence is needed, but doctors can consider this an option for their patients. Willie?
All right, Kelly O'Donnell at the White House. Kelly, thank you very much. Let's bring in NBC News medical contributor Dr. Nahid Badilia. She is an infectious disease physician and the medical director of a special pathogens unit at Boston University Medical Center. She also treated patients during the Ebola outbreak in West Africa. Dr. Badilia, thanks so much for your time this morning. Let's start with the big picture of where we are, because this changes not even week to week, but day to day and hour to hour. You've studied outbreaks around the world. Where would you say the United States is right now in terms of containing this outbreak, this virus?
Yeah, I've actually been really surprised at how behind the ball we've been at every stage of this, right? And I've worked in areas that have a lot less resources, and you expect those constraints, you expect those pinch points. The issue here has been what we're not taking into account is that if you have a disaster in one place, you can produce the items that are needed and you can plan ahead and make sure that that area is taken care of. This is a global disaster. This is a global pandemic. So we expect supply chains to be affected. We expect that a lot more pinch points will appear. And from the beginning, we've gone from being reactive at every stage rather than being proactive, which is what we should have done. We need to first and foremost accept that this is happening, that we're going to see an increasing number of patients, and then plan from that point forward, because if we keep reacting, we'll always be behind the ball.
Everyone's hoping there's some kind of a drug that can help with this. Of course, the vaccine is a long ways off. The president has been touting, as Kelly said, this malaria drug that he believes may help. The FDA has had to sort of say, pump the brakes. We haven't approved that yet. Dr. Fauci has sort of poured a little bit of cold water on that as well. Where do we stand on getting approval for this kind of treatment?
There's a reason why every new drug, even when it's a drug that already exists on market, needs to go through the study period. It needs to go through the clinical trials, because we need to make sure that we're not giving people false hope. We need to make sure that we're not getting into a situation where we start giving a drug with unintended consequences without realizing, what those are if we give to a massive number of people. So I agree with Dr. Fauci's point, which is you cannot make this recommendation on the medical level until you have better data. And right now, for hydroxychloroquine or chloroquine, the malaria drug that you mentioned, there's very small studies that have shown some promise. And with any of these emerging infectious diseases, science needs to lead. If we take gut reactions without the evidence, we could potentially cause more harm than good.
And quickly, Doctor, before I let you go, two critical areas we know: testing and getting medical equipment into these hospitals. Where do we stand on those two questions?
Every hospital and all my colleagues across the country that I'm talking to are holding their breath because they're worried that they're already seeing their supplies dwindling, and if the number of cases keep increasing, we're going to have issues. I honestly think by the time we ask more production to happen, we'll already be in dire straits. That needs to start happening now. In terms of the test, there is some good news. You may have heard this. Cepheid, one of the companies that actually produces the flu test and other, common tests, has come out with a test that could turn around for 45 minutes. But to do that testing, you still require healthcare workers. You need the personal protective equipment. So I think for a while we'll still see that it's the sickest in whom this test will make a difference, and that's who we're going to try to test first. Dr.
Nahid Bhadelia, we're so grateful for your insights on a day like this. Appreciate you being here. Chuck Todd is NBC's political director and moderator of Meet the Press. Chuck, good morning. Good to see you. So the president has been leading these daily briefings every day. We'll get another one today. You've got Vice President Pence and the various doctors, Dr. Birx and Dr. Fauci up there as well. The president has been engaged in this sort of ping pong that we watch, where he goes and makes a claim, says something's been cleared by the FDA, or says this drug works, or says I haven't heard about people not being able to get tests. Then Dr. Birx or Dr. Fauci steps to the podium and sort of gently rebuts what the president had just said. What does the president view as his role right now? How does he see himself in all of this?
It's a great question. I think he just wants to be seen as the one leading the response. I think that's why he's gravitated to these. But at the end of the day, the federal response feels like it's two steps forward, and then the president participates, and he's a singular one step backward instigator sometimes when it comes to the confusion that gets there when it comes to medical treatment, confusion over the Defense Production Act. I mean, he invoked it, he's using it, not using it. There's confusion on that. And so look, it's been like with everything with President Trump. He wants to be the singular point person on everything if that is where the light is shining brightest. And right now, those coronavirus daily briefings are where the light is shining brightest.
Chuck, we've seen a bunch of reporting, especially from the Washington Post over the weekend, that the president got warning signs early in January and in February and sort of ignored them and was trying to project confidence publicly. The country is very anxious right now. There's no getting around that. Go to any house, talk to any friend. How is the president, from people you talk to behind the scenes, how is he handling this privately?
Not very well at all. He's panicked about it. He's constantly looking for a miracle answer to this, which is why early on he kept saying, you'd hear about, well, this thing will burn out when spring turns to summer. He's constantly hoping that there is some miracle around the corner that sort of erases this whole thing. I mean, he had this whole, and obviously it's all tied into his reelection. He viewed the stock market and the economy as basically his lifeline to getting reelected. That has been totally obliterated by this crisis, and now he knows he's going to be judged on how he handles this. And I think he's just not prepared for that kind of campaign yet. And so, as with everything he does, he makes it about himself, and I think that's where he finds himself, creates more problems for himself than he needs to.
Yeah, he said once this will sort of magically disappear, perhaps some wishful thinking on his part. Chuck Todd, thank you as always. We'll, of course, look for much more this morning on Meet the Press when Chuck is joined by New York City Mayor Bill de Blasio.